Hi, I'm Dr. Howard Lux. This discussion is going to be on shoulder pain, but particularly shoulder pain that occurs at night. If you suffer from night pain because of your shoulder, I don't need to tell you just how bad it really is. I see people here throughout the day who aren't sleeping. They're very uncomfortable. Every time you toss and turn, your shoulder hurts. You try lying on it, you try lying on your back, you try lying on the other side, and no matter what you do, it's hurting. Why is your shoulder hurting? The number one cause of shoulder pain, especially pain that keeps you up at night, is your rotator cuff. Now, just because I mention the words rotator cuff, don't automatically go ahead and insert the word tear there. There are many reasons why your rotator cuff can bother you. The most common reason is rotator cuff tendinosis. That means your rotator cuff is degenerating, it's wearing out. It's like your favorite pair of blue jeans, or one day you look down and you have a hole there where your knee is. Your rotator cuff tissue, unfortunately, isn't very different, and it can wear out too, but in the process of wearing out, and when the tissue becomes degenerative, it can hurt. It turns out that the rotator cuff will grow new nerve endings, and that area will be very sensitive. Calcific tendinitis, or calcium deposits in your rotator cuff, we don't know why they occur. They occur pretty commonly around the shoulder. They can affect almost any tendon in your body, but the rotator cuff is the number one area where they tend to show up. Where we get an x-ray and we see this blob of calcium sitting in your rotator cuff. We don't know why it got there, but we know it hurts like hell. Many of you are miserable. There's dark circles under your eyes, and you just can't understand why your shoulder is hurting so much. Now, why does this hurt at night? We have no idea. Is it the loss of gravity, the fact that you're now recumbent or lying on your back? Again, we don't know. All we know is you need relief. Rotator cuff tears can hurt at night as well. Typically not as bad as patients who have calcific tendinitis or rotator cuff tendinosis. However, rotator cuff tears also produce pain at night. And for many of you who are thinking about surgery, from all your reading on my website, you know that not all rotator cuff tears or problems require surgery. However, night pain becomes a huge quality of life issue. As such, it tends to play a big role in determining whether or not you're going to opt for surgery in these circumstances. For those of you with tendinosis, typically a cortisone injection will help a lot, and then physical therapy can help rid you of the problem for now. Calcific tendinitis, the majority of you don't need an operation for this. You find a radiologist, they stick a needle in there using an ultrasound machine, and they wash the calcium away. Most of you are extremely pleased after that procedure. With regards to rotator cuff tears, again, there's many determinations that go into whether or not we choose to proceed with surgery or physical therapy or injections, etc. That's for another discussion on another day. So, I'm sorry you're suffering from such severe pain at night. You're not alone. There are remedies. Reach out to your local orthopedist and let us help you. Bye.